Yo, what's going on, guys? Before you check out this video, I just want you to know if you're on Facebook or Instagram, make sure you check those out down here below because I'm constantly putting up content on those as well if that's your platform. Enjoy the video. Yo, what's going on, guys? Chris Bonner here, Overtime Athletes. The question I want to address today that I often get is about jumper's knee. Obviously, I make a lot of videos on vertical jump and sprinting, and a lot of you guys ask me in regards to jumper's knee. A lot of times I negate this because I'll preface this video by saying that a lot of you guys self-diagnose jumper's knee and you may not have that. You might have something more. So I have no ego in this and say it's out of my scope. So if you're experiencing extreme discomfort and you want to have a lasting career, you should probably get that checked out. Now, if you're experiencing a little discomfort, or if one of my athletes is experiencing a little discomfort, here's the plan of action or the ideas that I might possibly give one of my athletes. Usually I can pick up on it by watching them move or seeing what kind of imbalances they may have. However, if I'm not experiencing that, there's some ideas that I want to support you with. So, to start off, jumper's knee is essentially known as patellar tendonitis, right? So patellar tendonitis, you're just experiencing some inflammation across the knee joint. Now, when you experience discomfort across the knee joint, it's usually because when you have, if you are trying to compensate across the other joints, meaning your ankle or your hip, usually you overload on the knee, and that's why we experience a lot of pain, discomfort, tears, whether it be MCL, meniscus, ACL, a lot of those occur because of you're overcompensating across the knee joint, right? And to address this, I want to offer 4 different ideas. First one, to relieve the comfort, is going to be passively elongating the muscles in the quadricep. A lot of guys, what they start off to do is when they experience this is they want to go ahead and pull a quad stretch, right? Or some guys even do a hamstring stretch I've seen. But a quad stretch is actively elongating. You're essentially pulling those muscles when you're stretching. What I like to do is I like to utilize a foam roller. And by utilizing a foam roller, you're passively elongating the muscles. So I'll get on the foam roller and I will actually foam roll out all the way across the quads, down the side of my leg, really loosening up those muscles and almost like massaging those muscles to, again, passively elongate those muscles as opposed to pulling on them. I've actually experienced people who, actively stretch it and they might experience a little more inflammation. Second one that I'll offer is going to be your glute strength. So with your glutes, if your glutes are weak, one, it can place your knee out of place. So essentially, if I'm jumping and my glutes are pretty weak, they can't support that. You'll see sometimes guys with their knees cave in. And like I said, if you have a lack of glute strength, you'll overcompensate across that knee joint. So one thing you'll want to do is make sure that you're strong, performing muscles that are essentially activating the glute and beginning to get them stronger. Number 3 is going to be lack of ankle mobility, right? So if you have dorsiflexion in particular, so if you have tight ankles, like I said again, if you have tight ankles, you're going to overcompensate across the knee, overload the knee, which is going to lead to inflammation. So you'll want to perform certain exercises where you're essentially focusing on driving that knee and really focusing on ankle mobility, pulling that toe towards the shin as hard as or as best as you possibly can. That's number 3. Number 4, I'll give you guys an exercise. This is usually typically used in physical therapy to strengthen certain muscles across the knee joint to support somebody when they rehabilitate from ACL surgery. What they're called is terminal knee extensions. These are often used as a prehab exercise, obviously prehabilitation, so you don't have to rehab. That's where they came up with that term. But what you're trying to do here, strengthening the last little bit of range of motion across the knee joint, is you're going to wrap a band, anchor a band to something, and you'll essentially wrap this around the back of your knee. And from here, all you're gonna do is go from your toe, and you're gonna stand tall, and you're just gonna drive your heel down straight back, straightening out your leg, and strengthening those muscles across the knee joint. And those are called terminal knee extensions, or TKEs. So there's 4 different ideas to help supporting you. I suggest trying a couple things. One, I suggest lowering the load or the amount of productivity you have on that when you're experiencing it. So if a lot of you guys are like playing basketball or you're doing a lot of jump training, cut back on that, and then start to utilize 4 of these different modalities. 1, foam roll, passively elongate those muscles in your upper limb or in your lower limb down the peroneals. 2, start strengthening your ass muscles, your glutes. 3, dorsiflexion, ankle mobility. And number 4, this is one of my favorite exercises, TKEs. So there's 4 different ideas for you to help solve jumper's knee. I hope that helps. Try it out. I want to see you guys back on the basketball court, jump training, jumping your ass off. I'll catch you next time. Hey guys, thanks so much for watching. If you're interested in becoming a better athlete, whether that be sprinting, jumping, strength, or overall looking like an athlete, go ahead and click the box here on my side and make sure that you subscribe to my videos here so I can keep sending them to you. Holler.